English conversation, a scenario of surgery. Guidelines for surgical procedures. Understanding key time-related terms, decoding surgery schedules. Emma is scheduled for abdominal surgery, and she receives information about the various dates and times associated with the procedure. Date of operation. This is the specific calendar date on which the surgical procedure is scheduled to take place. It marks the day when the surgery will be performed. Example: the date of operation for Emma's abdominal surgery is March 4th. Additional information. The date of operation refers to the scheduled surgical procedure date. While operation can have multiple meanings in general language, in the medical context, operation specifically denotes a planned surgical intervention. Surgery date. The surgery date is synonymous with the date of operation. It refers to the day when the actual surgical procedure will take place. Example: March 4th is both the surgery date and the date of operation for Emma's abdominal surgery. Admission date. The admission date is the day on which Emma is expected to be admitted to the hospital or healthcare facility in preparation for the surgery. Example: Emma's admission date is March 3rd, one day before the scheduled surgery. Additional information. To admit in a medical context means to allow someone, typically a patient, to enter a hospital or healthcare facility for treatment, care, or a medical procedure. When a person is admitted to a hospital, it signifies the official beginning of their stay for medical reasons. The term admission refers to the process of being accepted or admitted to a hospital for medical care. Admission time. Admission time specifies the time at which Emma is expected to arrive at the hospital for admission on the admission date. It's the designated time for her to check in, complete necessary paperwork, and undergo pre-surgery preparations. Example: Emma's admission time is scheduled for 10 a.m. on March 3rd. In the context of surgical procedures, there are several related terms that help outline the timeline and various stages of the process. Here are a few additional terms to be aware of. Preoperative evaluation. This refers to the comprehensive assessment conducted before the surgery. It includes medical history review, physical examinations, and any necessary tests to ensure the patient is well prepared for the procedure. Example: Emma completes a detailed preoperative evaluation for her scheduled surgery. Preoperative instructions. Guidelines provided by healthcare professionals to patients before the surgery. These instructions may include details about fasting, medications, and other preparations. Example: Emma follows preoperative instructions, fasting and adjusting medications before surgery. Operating room time. The period during which the surgical procedure actually takes place in the operating room. It includes the time from the start of the surgery to its completion. Example: Emma's surgery lasts approximately 3 hours in the operating room. Anesthesia time. The duration when anesthesia is administered to the patient before the surgery and monitored afterward. It covers the time from anesthesia induction to the patient's emergence from anesthesia. Example: Emma's anesthesia time is carefully managed at 2 hours, ensuring a painless surgery and a smooth recovery process. Recovery room. Post-anesthesia care unit, PACU, time. The time spent in the recovery room immediately after the surgery. Patients are closely monitored as they wake up from anesthesia and stabilize before being transferred to a regular hospital room or discharged. Example: Emma spends hours in PACU, closely monitored after her surgery. Discharge date. The day on which the patient is officially discharged from the hospital following the surgery. It marks the end of the hospital stay, and the patient may continue recovery at home. Example: Emma's discharge date is set for March 5th, marking a successful recovery and return home. Follow-up appointment. A scheduled medical appointment with a surgeon or healthcare provider after the surgery to monitor recovery, address any concerns, and discuss post-operative care. Example: Emma had a follow-up appointment a week after her surgery. Post-operative care. The ongoing care and management provided to a patient after the surgery. This includes medications, wound care, and follow-up appointments to ensure a smooth recovery. Example: Emma diligently follows post-operative care instructions for optimal recovery. Here's a simplified timeline for Emma's surgery. Example: 1. Preoperative evaluation, conducted a few days before surgery. 2. Preoperative instructions, given a day before surgery. 3. Admission date, March 3rd, the day before surgery. 4. Admission time, 10 a.m. on March 3rd. 5. Date of operation/surgery date, March 4th. 6. Operating room, or time, approximately 3 hours on March 4th. 7. Anesthesia time, administered just before surgery on March 4th. 8. Recovery room, PACU, time, several hours post-surgery on March 4th. 9. Discharge date, March 6th, 2 days after surgery. 10. Follow-up appointment, scheduled 2 weeks after surgery. 11. Post-operative care, followed immediately after surgery and ongoing at home. Understanding these terms helps patients navigate the entire surgical process, from preparation and admission to the actual surgery, recovery, and post-operative care.